Bismillahirrahmanirrahim. Now we are going to demonstrate the elbow joint, in which we have to cover the humerus bone, radius and ulna. So humerus is already covered in the shoulder joint. Now we are going to discuss the radius and ulna. So this is your ulna bone, this is the radius bone. So radius bone, if you look at the three areas, this is proximal, this is the shaft and body, this is the distal part. So if you look at the proximal side, so please focus here. So here is your head. So this is head, and inferior to head, of course, neck is present. And you can see here a tuberosity here. We name them the radial tuberosity. So this is all about your proximal end. Let's look at the shaft. In the shaft, you will find three border and three surfaces. So because we have to, in this way, you can see here, this is your interior border, this is your posterior border, and this is the introitious border, which is toward the introitious membrane. So if this is the border, so you can see here, this become the interior border, interior surface, this become the posterior surface, and this become the lateral surface. Why? Because the radius is always on the lateral aspect. So in this way you can demonstrate it. If this is the introitious, this is interior, this is posterior, so this area become the lateral surface, and this become the interior surface, and on the back side you will find the posterior surface. So three surfaces. This is all about your the shaft and body. Let's closely look at the distal end. In the distal end you will find the acetylide process and the notches, and here you will find the notch for the Saké fat, and here you will find notch for the lunate, because this is forming the joint, the distal joint, which is with the carpal joint. So satellite process here, because they are lateral bones, so satellite should be always on the lateral aspect. So this is the interior view. If you look at the posterior view, you will find a tuberosity here. So this tuberosity is for the dorsal tuberosity vein, because on the dorsal aspect. So this allow the tendon to pass into the carpal bones or metacarpal bones and toward your hand. So this is the tuberosity or pathway for the tendon passing. So let's look at the ulna bone. So if you look at the ulna bone, you will find two processes, two notches, and one tuberosity at the proximal end, and you will find this body and shaft and this end here. So posterior end, distal end, this is proximal end, this is distal, this is body and shaft. So if you look at here, so this is your first process. We call them the olecranon process. This is your conoid process, and this notch is the trochlear notch. So, and you will find another notch here on the side, which is the radial notch for the radius attachment. So if you look at the head, it is attached in this way. So it is attached here, and they can move at this way. So here is attachment of your the ulna. If you look at the body and shaft, here we also find, because this is your medial bone, so it is the one body interior, one is posterior, and the introitious, similar with the radius. So this surface become the interior surface, this become the posterior surface, and this become the medial surface, not lateral. Lateral because for the lateral bone. So in this way you can, if you look at, this is the lateral, this is lateral. So this is interior, this is interior, this is posterior, this is posterior. If you look at the distal end, you will only find distal end as well as this satellite process on the medial aspect. So if you look at the joint which is between the radius and ulna, one joint is formation is here. So that is pivot joint, and important for the pronation and the supination. So when they supinate or pronate, so when you move in this way, this radius come in far interior to it. So then move back. So they can rotate at this pivot point. So, and if you look at the olecranon process, so that is forming another joint with the humerus, and that is elbow joint. And at the distal end, you will find the notch for the on the radius, that is the ulnar notch, because this is radius, so notch for the ulna. So your ulna will attach at this point. So the head of ulna attaches here, and the head of radius attaches on the upward side, so they can rotate in this way. So in between, one is proximal joint, one is the distal joint, and this pivot type joint, and this is your introitious, which is the immovable joint. So they are tightly attached with each other. So if you look at the this olecranon process, which is just here, so when you move in this way, extend this enter into your olecranon fossa of humerus. So and when you move flex in this way, so these this trochlear notch will enter into the this the fossa of your of your humerus, and on this side you will find this head enter into the in this way. So if you look at put at here, so you will find in this way, in this way. So actually it is associated in this way. So you move in this way, and your olecranon, which is on the backward side, they attaches just here. You can think about this. Here is your humerus bone. You can see here the medial epicondyle, the lateral epicondyle, and you will find this the conide process of your ulna is entering into this fossa. So that is fossa for the ulnar bone, and this radial complete radial is entering into the radial fossa. So conide fossa, and the further, and the backward side you will find the olecranon fossa, where olecranon process is entering. So in this way, the extension olecranon is here, and the flexion it is attached here. So it is a hinge type of joint, so only flexion and extension. So and if you look at the fracture, if you radial at the proximal end, so you will find fracture most common when you fall from a bike in this way. So the fracture is for the olecranon process. So you will find in radiological picture many. So at the distal end, and other fracture is important. So when you fall in this way, outstretch fall, so they may break a distal end. So and the radius and ulna joint can be separated or dislocated when that is nurse made dislocation, when someone put, it is most common in the children when a mom or nurse pick up their child from by this forearm, so the joint can be dislocated. So that is nurse made, and here is your Colles fracture. And then we have to cover the wrist joint in the next lecture. So that is all about your elbow joint. Thank you very much.